So, good evening, ma'am, and all the others present over here. I am Gayatri from Applied Psychology Department, and today I'll give my presentation from the article Consent, written by John R. Williams. So, starting off with the article, this article is mainly, concerned about the concept of consent. What is it about? Why is it necessary to obtain it? And in what all conditions it is difficult to obtain a consent? So, catering to the first aspect of the article, that is what consent is, a well defined definition has been given by Butem as well as Faden that described consent as a autonomous authorization of the medical interventions. So, if I put this basically definition into a simple word, consent basically refers to the willingness on the part of the client to accept a suggested treatment by the clinician. This concept of consent has grown worldwide, and it is considered to be a very important part in every clinician as well as client relationship. The consent has three components in it, as described by the author itself. That is disclosure, second is capacity, and third one is voluntariness. Disclosure basically means the communication that takes place between the clinician as well as the client, where the clinician facilitates the client with all the relevant information about the treatment. Second is the capacity that refers to comprehension and understanding on the part of the client of the treatment and what all the possible apprehensions as well as all the possible apprehensions and consequences that might occur as a part of his decision. The third is voluntariness that refers to the liberty as well as freedom on the part of a client to take or to basically take up a suggested treatment. Further talking about the types of consent, there are two types of consent and both of them are quite different from each other. The first one is explicit consent. Explicit consent is mainly given in the form of oral or a written form, whereas implicit consent is shown in our behaviors. For example, I'll give you an example to illustrate. We go for a blood test. So in that there is no such there's no such consent being taken from us. In that particular situation, we just extend our arm towards the person who's taking a sample, and the person gets to know that we are willing to give the sample. So in this way, I would say that implicit consent basically is exhibited through our actions. That we are willing to participate into a particular treatment procedure. So from this, I hope it is clear that what consent is and what is its meaning and definition. Now moving on to the second aspect of the topic that of the article, that is why is it necessary to obtain consent and in what all conditions it is difficult to obtain it. So there are many reasons that shows that it is necessary to obtain consent. The first one basically is ethics. As we did in last year also in philosophy itself, that ethics refers to a set of moral principles that dictates a person's behavior or a conduction of a particular activity. So basically, in ethics, it is very important to take a informed consent. However, as we all know that there are always barriers or obstacles to something. So as a result, there are barriers in this also. For example, linguistic barriers or cultural differences. Both a clinician and client might be of different cultures. There are language barriers between the client and the clinician, or the complexity of the medical situation of the client. As a result, the clinician is unable to give a comprehensive view of the treatment. The next basically reason that shows why consent is important is law. It is a legal requirement to obtain a consent in many of the countries. For example, if I talk about UK, there is a common law which states that receiving or taking a consent, if we do not take a consent, it is considered to be a battery. Or if the clinician gives ambiguous information to the client, it is considered to be a negligence on the part of the clinician. The third important aspect that shows that it is important to obtain a consent are the various studies that have been conducted. There are studies that have been conducted that have proved that the communication between the physician and the client facilitates positive health of the client. I give an example. For example, a client is suffering from a severe disease, for say cancer, and the clinician has suggested him or her to undergo chemotherapy. This automatically leads to negative symptoms as well as thoughts and feelings in the mind of the client. However, if the clinician provides a detailed account of how the treatment will look like and what the treatment procedure will include and how the client will feel in this treatment procedure, what all positive outcomes can come out of this procedure, will definitely help the client to feel satisfied. He or she will also feel informed about the same and would definitely let go or would mentally prepare himself for the treatment. Now, catering to the third aspect, that is, in what all conditions it is difficult to obtain a consent. The first condition is when the client is not confident enough to take a decision or is incapable of taking a decision. In such a situation, the client believes or the client basically trusts the clinician that he or she has more authority of taking a decision. However, it should be noted that the clinician should not act impulsively in any manner. The clinician should always try to encourage the client to take his or her own decision by providing relevant information about the treatment and all of that. However, if it is not possible, then law also states that the basically the clinician can take or can ask the substitute decision maker of the client to take a particular decision. The second condition in which it is difficult to obtain consent would be when there is some medical emergency of the patient or a client. In such a situation, if we consume so much of time in taking the consent of the patient, then this might be lethal to his life and might consume a lot of time. So in such a situation, the clinician can take the decision. However, they should make sure or they should keep in mind that if the client would be capable of taking a decision whether he would take this treatment or not. The third basically important aspect is that the clinician should make sure that any information that he or she is disclosing should not harm the psychological or physical health of the client. For example, if it is shown that if a client being suffering from a terminating illness that ultimately lead to death, for instance, a severe brain tumor or something. So in such a situation, the clinician can withhold the information with himself, as because disclosure of the information might make the miserable life the rest of the life of the client as miserable. So in such a situation, physician can keep all the information with himself. Therefore, physicians should take in account of all the personal, physical as well as social factors that might influence the client before taking a consent. So, on concluding, in short, I would say that receiving or obtaining a consent does not only involve decision making on the plan on the part of client, but also involve problem solving. For example, if a client has given consent, right? So it does not basically mean that the client would have to obey everything that comes into the treatment process. If he or she has some doubt regarding the treatment, then he or she can definitely probe the questions in between and ask the clinician about the same. So, in short, in a nutshell, I would say that in consent while we are receiving consent or in any client or clinician relationship, both client as well as clinician have an active role to play, and neither of them has a passive role. So, yeah, thank you, ma'am.
Good morning, ma'am. I'm Anushka from Applied Psychology Honors, and today I'm doing the data philosophy presentation. And I'll be talking about the meaning of consent and its component. And I have taken this topic from the article Consent, which belongs to the author named John R. Williams. So, talking about the meaning of consent means acceptance of the recommended treatment. This term also encompasses this term also encompasses the choice of an alternative treatment and a treatment refusal as well. Consent is not a one-time event; rather, it is a continuous process that should take place between clinician and patient relationship. Patients have all the right to take the information of their medical care and to get the information about their decision making process. The term consent has its three components. The first one is disclosure, second one is capacity, and the third one is voluntariness. Talking about the disclosure, which means the communication of the relevant information from the clinician to the patient and the comprehension of that information from the patient. Talking about the capacity, then it is the ability of the patient to accept the fact and appreciate the consequences of his or her decision, which may or may not be true. Now coming to the volunteerness, which means the right of a person, right of the patient to make decision about his or her medical treatment without any force or manipulation. So, obtaining patient's permission for the his or her medical treatment is considered to be the legal obligation in many nations. And consent can be explicit or implied. Sorry, consent can be explicit or implied. Explicit consent is can be oral or written. Implied consent is implied when the patient is willingly ready to undergo certain procedure or to ready for the medical treatment. Consent is explicit when consent explicit can be orally or it can be written. Consent is explicit when there is a direct communication from the patient and to the doctor. So it can be written or orally, like from by the signing of paper, and it can also be given by like saying, for example, saying yes, I consent. So this can be done this way also. It is not a time explicit consent is not a time limited until and unless the patient draws his or her consent. So as compared to the explicit consent, implied consent is more difficult to prove because it is taken through the action, and explicit consent is easy to prove because there is a direct communication. So, in this presentation, I have talked about the meaning of consent, which is the acceptance of the recommended treatment, and I have also talked about its component, which is volunteerness, capacity, and disclosure. And I have briefly talked about the implied and explicit consent. Thank you.
Evening everyone, myself Komal Sharma from Political Science Honors Department, and today I am going to talk about the topic consent from the article Consent written by John R. Williams. So first let us know what consent is. So generally consent is the process by which the treating healthcare providers discloses appropriate information to the competent patient so that the patient may make a voluntary choice. Consent can be defined as the autonomous authorization of medical intervention by individual patients. The main purpose of consent is to protect the patient. There is a widespread consensus in both ethics and law that patients have the right to make decisions about their medical care and to be given all available information relevant to such decisions. Obtaining consent is not a discrete event, rather, it is a process that occurs throughout the relationship between clinician and the patient. Although the term consent implies acceptance of the suggested treatment, the concept of consent applies also to the choice among alternative treatment and the refusal of the treatment. Components of consent. There are three components of consent: disclosure, capacity, and voluntariness. Disclosure refers to the communication of relevant information by the clinician and its comprehension by the patient. Capacity. It refers to the patient's ability to understand the information and to appreciate those consequences of his or her decision that might reasonably be foreseen. Voluntariness. It refers to the patient's right to come to a decision freely without force or manipulation. Types of consent. Mainly, there are two types of consent: implicit and explicit. Explicit consent. It can be given orally or in writing. It can be given in the form of a signed document. Implicit consent. It is also known as implied consent. It is the consent implied when the patient indicates a willingness to undergo a certain procedure of treatment by his or her behavior. For example, consent for venipuncture is implied by the action of rolling up one's sleeves and presenting one's arm. For treatment that entail risk,
or involve more than wild discomfort, it is preferable to obtain explicit rather than implicit, as explicit consent is given in written form. In conclusion, I would say that a signed consent form documents but does not replace the consent. There is no universal rule as to when a signed consent is form is required. Some hospitals may require that the patient sign a consent form for surgical procedure, but not for other equally risky interventions. If a signed consent form is not required and the treatment carries risk, clinicians should write a note in the patient's chart to document that the consent has been taken. Thank you, ma'am.
Hello everyone, my name is Labhanshi. I'm from Applied Psychology major and I would be presenting on the Unit 2 Consent, and it was written by John Robert Williams. So I'm very sure that you all must have heard about the word consent because lately it has been so much in the news because of the criminalizing marital rape, and the men, because the men, certain men of India went on marriage strike. So basically, consent, if I am to explain, consent simply means allow or give permission to do something. But if we consider the term in the connotation of bioethics and medical terms, it defines as, and I quote, autonomous authorization of a medical intervention by individual patients. This definition was given by Bouchon and Faden. So basically, consent means that if a clinician or a practitioner gives different suggestions to the patients are free to accept the suggested treatment. Either it can be a choice between two options, it can be a choice among the options, or the patient can simply refuse to accept the treatment. So, for example, if a clinician gives, for example, if a patient has to go for some knee operations or a knee surgery, the clinician can give them options of injection or like cartilage regeneration, and the patient can choose between it. Or they can choose among the options like injection, cartilage regeneration, radio frequency ablation, or the third option that they can simply refuse all these treatments and they can cure themselves by simple medications and losing their weight. So it completely and utterly depends upon the patient that what treatment that they want to go for or opt for. So, if I talk about the components of consent, it has three components and it can be remembered by DCV, which is D for disclosure, C for capacity, and V for voluntariness. Disclosure simply means, and it is given by the doctor, the transparency of the procedure that the patient, it would be operated on the patient and the doctors are going to follow. So it is also, disclosure also means that the patient should be in have the ability to comprehend whatever the doctor or the practitioner is saying. Capacity is simply C for capacity, which stands for capacity, which means that the patient should be enough able to understand and handle the consequence of the procedure or the operations or the surgery that is going to be performed on the patient. V for voluntariness, which means that the patient should be, they are free to take any decision that they want to. And I would like to again explain you the example of injection cartilage regeneration or radio frequency ablation. So, if the patient is going for a knee surgery, they can go for any of the following options, and that should be done voluntarily. There are if we are talking about the types of consent, there are usually two types of consent that we study, which is explicit and implied. Explicit consent basically means that it is usually in the oral or verbal, oral, or written format. So, for example, if you are going to a hospital for like getting a major or even a minor surgery, they ask you to fill a consent form or documents and verify all your documents in the form of explicit consent. But for example, if you went for your blood test, or for example if you went for like an MRI, you just simply go there, sit on the chair, roll up your sleeves, or you just simply go there and sit down on the machine. So this is a very implied consent which is only observed through actions and it does not require any verbal or written means. Now that we know that what are the components of consent, what are the types of consent, and what majorly what consent actually means in biomedical terms, we come to the very important topic: why is it important? Now we must be wondering that, okay, if a consent is given by the doctor, and the patient is, free to take decisions and stuff, this is known as the principle of autonomy. And the basics of consent is just based on the principle of autonomy, and it is very, very important and crucial for a patient to know what procedures are being performed on them. So there are, except of all these the consent procedures that we follow, there are two exceptions in biomedical terms. One is when a third party or the clinician themselves take the decision for the patient. So for example, if the patient is, they went for a surgery, and some emergent, urgent procedure needs to be followed by the patient. So their relatives or the clinician themselves can take up, can take the decision of performing that particular procedure on the patient, or when the patient themselves trust the clinician with their procedures. So this is one condition where an exception to consent is implied. And the second one is when there is a harm telling the patient about the procedure. So for example, if there's a like psychologist or a psychiatrist, and they need to be very explicit about all the procedures they need to follow, but that would lead the patient to be suicidal, they can die by suicide. So in that case, a psychologist or a psychiatrist have the full right to hide some of the procedure or some of the information and not require the consent of the patient. So, all in all, I would like to conclude on the note that fully informed consent is the most ideal way to go, and the most ideal and the ethical way to go about in medical terms. Thank you so much.
Good evening, everyone. I'm Lamu, and today I'll be speaking on the topic how should one approach the consent process in practice from the article Consent. The article provides an overview of consent, relating it to the underlying ethical principle of respect for autonomy, and pointing out that consent is not simply about acceptance of a suggested treatment, but about choice between a range of options, including the option of refusing a treatment. Obtaining consent is a process that should occur throughout the relationship between clinician and the patient. Patients have the right to be given all the information, even regarding the refusing of treatment. And during the consent process comes problem solving and decision making. So, clinicians often struggle with the question of how to apply the ethical and legal concept of consent in their daily practice. It is helpful to distinguish between the process of problem solving from that of decision making. So, problem solving involves identifying problems of the patient and developing a list of treatment options, and decision making involves choosing from various treatment options. So, obtaining a valid consent requires that patients participate in problem solving as much as they wish, and patients should be free to ask questions and receive answers about treatment options. And the consent process also requires that a patient actively participate in decision making and authorize the decision. Even if the patient is predisposed to follow the clinician's recommendation, the clinician should actively engage the patient in the consent process. So there are a few exceptions during consent process. So the common law recognizes that emergency treatment of incapable person is an exception to the requirement of consent. In common law, emergency exists when immediate treatment is required in order to save the life of the patient. So the rationale for this exception is that a reasonable person would be consent to the treatment, and that a delay like if there is a delay in the treatment, that would lead to the death or serious harm of the patient. So that's why in some provinces emergency may be defined differently, in statutory law and than in common law. So clinicians must be aware of the legislation in their own provinces. So the emergency exception to the requirement to obtain consent has important limitations. Clinicians should not administer emergency treatment without consent if they have reasons to believe that the patient would refuse such treatment if he or she were conscious. So, for example, if a physician provides a blood transfusion to a patient who is unconscious or who is in severe injury, the patient and if the patient is carrying a sign card or a signal indicating that she does not want to receive any blood transfusion under any circumstances. So despite this information, even if the clinician gives blood transfusion, although the transfusion may have saved the life of the patient, but according to the law, the court would find the clinician liable for battery and holding that the written instructions from the patients were uh, clear and precise, and that clinicians was bound by them unless he or she has good reasons to believe that they did not truly represent the patient's wishes or ideas. So if a patient is mentally incapable of making medical decisions, the clinician must obtain a consent from a substitute. The statutory law of some province permits non-consensual treatment in specific circumstances, such as involuntary admission of psychiatric patients and the treatment of patients with communicable disease. So, in conclusion, there are various other potential exceptions to the requirement to obtain consent, as well as that problem solving and decision making is important during the consent process. Thank
Forwarded by John R. Williams on the topic consent explains about the concept and why consent is so important in regards to ethics, law, policy, and empirical studies. In the article, Law, Policy, and Empirical Studies, we have talked about how one should approach for consent in practice. As Buchan and Fedden says, consent can be defined as the autonomous authorization of a medical intervention in an individual manner by the patients. There has to be a consensus in both ethics and law that patients have the right to make decisions about their medical care, and he is to be provided with all the relevant and available information to make such decisions. Now, coming back to the practical aspects of consent, requires the obtaining of a valid consent in cases where the patients make the decision and participate in the problem solving process regarding their healthcare. Patients should be free to ask questions related to their medical issues and receive good relevant information regarding their treatment options. The patients in a practical form should make decisions and authorize it on their own. It is the clinician's duty to make the patient actively engage in the consent process and the decision making process. But there are exceptions to this, like cultural differences is one of them. In some cases, the healthcare professional does not feel obliged to provide information to the patient when the diagnosis is a terminal illness to save the patient from any kind of psychological disparity. Even family members agree to the doctor's decision here. Healthcare professions feel sensitive to cultural as well as in the personal level while communicating a bad news. For example, providing like info terminal illness information to the patient to save him from any kind of psychological disparity, or informing the family about the death of the patient. But in today's date, the patient's right to consent is being widely accepted, and it is the physician's duty to help the patient practice this right of consent. For example, if Mrs. A is diagnosed with a terminal kind of illness, for example, regarding lungs, then the physician may not feel obliged to inform the patient about his illness to save him from psychological disparity. However, if there is a similar kind of illness regarding a surgery to his lungs, then the physician should take the consent of the patient, should provide all the available information to make proceedings with his treatment. Thus, to what extent patients have the right to the consent is a major topic of controversy to medical and bioethics today. Until this appropriate guidelines or any kind of instructions is provided by the government or any kind of medical institution, the individual physicians exercise the right to decide for the patient's consent regarding the treatment. Thank you, ma'am.
Good evening, everyone. I am Santoshti, and today I will be talking about consent. In general terms, consent occurs every day in many different ways of interactions when one person voluntarily agrees to the proposal or desires of another. It is a common it is a term of common speech with specific definitions as used in such fields of the law, medicine, research, and even sexual relationships. Consent, as understood in specific contexts, may differ from its everyday meaning. Talking about consent in the field of medicine, in the article written by John R. Williams, consent is defined as the autonomous authorization of a medical intervention by individual patients. There is a widespread consensus in both ethics and law that patients have the right to make decisions about their medical care and they should receive all relevant information to make such a decision. Obtaining consent is not just a discrete event, rather, it is a process that should occur throughout the relationship between the clinician and the patient. Although the term consent implies acceptance of a suggested treatment, the concept of consent applies also to choosing among alternative treatments and to refusal of treatment. Consent has three components that are uh, disclosure, capacity, and voluntariness. First, disclosure refers to the communication of relevant information by the clinician and its comprehension by the patient. That is basically providing the patient with all the necessary information needed to make a decision regarding the treatment. Second, capacity refers to the patient's ability to understand the information and to appreciate those consequences of the decision that might reasonably be foreseen. And last, voluntariness refers to the patient's right to come to a decision freely without any kind of force, coercion, or manipulation. Uh, for example, let's look at a patient with a malignant tumor. Suppose this patient is being treated by one doctor. The doctor is supposed to provide all the information to the patient about their condition and all possible treatments that are available, such as surgery or chemotherapy or any other kind of treatment. And this stage is called the disclosure. Next, the patient's ability to understand the information provided and being able to weigh in the pros and cons of each treatment is the capacity of the patient, and the patient making their own decision with force without any kind of force or coercion would be voluntariness, and this includes all the three components of consent. Consent may be explicit or implied. Explicit consent can be given orally or in writing. Consent is implied when the patient indicates a willingness to undergo a certain procedure or treatment by their behavior. For example, consent for a venipuncture test, that is a simple blood test, is implied by the action of rolling up one's sleeve and presenting one's arm. For treatments that entail risk or involve more than mild discomfort, it is preferable to obtain explicit rather than implied consent. A signed consent form documents but does not replace the consent process. There are no universal rules as to when a signed consent form is required. Some hospitals may require that that patients sign a consent form for surgical procedures, but not for equally risky interventions. If a signed consent form is not required and the treatment carries risk, clinicians should write a note in the patient's chart to document that consent has been given. For example, if the patient has diabetes or is allergic to a certain drug necessary for the treatment, or if the treatment itself carries a risk or a higher mortality rate, in such cases documented consent is vital. With this, I would like to conclude my presentation. Thank you so much.
Afternoon, everyone. My name is Sneha Batra, Applied Psychology Honors Department, and my topic for today's presentation is Why is Consent Important? From the article Consent by John R. Williams. Let me start by giving an overview of the article. So, this article provides an overview of consent, relating it to the underlying ethical principle of respect for autonomy, and pointing out why it is important and how it can be practiced. So, what is consent? Consent, as defined by Bosham and Forden in 2004, refers to the autonomous authorization of medical interventions by individual patients. So, in simpler terms, consent is the choice that a patient makes to undergo a procedure. Consent has three components: disclosure, capacity, and voluntarism. Disclosure refers to the communication of relevant information by the physician to the patient, as well as the comprehension of that information by the patient. Capacity refers to the ability of the patient to understand that information and appreciate the consequences of his or her choice. Voluntarism refers to the ability of the patient to make a free choice without any manipulation or coercion. Consent can either be explicit or implied. Explicit consent is mostly obtained orally or through writing. For example, whenever most of us went to get a vaccine, we were given a consent form where we had to sign saying that we know the side effects of the vaccine, but anyway we are willing to take it. Consent is implied when our behavior show that we are willing to undergo that treatment. Most of the times when we are getting a medicine or an injectable medicine, we will nod and show our consent that yes, we are ready to take it. These factors take us to the main point, which is why is consent important? Consent is important along four dimensions. First, being ethics. So the fundamental ground of consent is the underlying principle of respect for persons and autonomy. Autonomy refers to the ability of a person to make his or her free decisions regarding their own health care. Respect for persons can be achieved when healthcare professionals are encouraged to let the patients make their own decisions and refrain from carrying out any unwanted or unnecessary treatments. Now, fully informed consent is a ethical ideal which is seldom realized in practice. There are many obstacles like irrelevant medical information, or complexity of the medical information, etc. There are two instances in which a person can be allowed to exempt the need for informed consent. First, when the patient themselves hand over their right to their waiver or hand over their right or decision making ability to the clinician or the third person. They might tell the clinician that do what you think is best. However, we need to note that at this point, the clinician should not be eager to, act on such a response, and rather should encourage the patient to make their own decisions, unless it is someone who is not competent enough to make their own decision. The next instance is where the revelation of relevant information can cause harm to the patient. In such cases, the principle of therapeutic privilege is invoked, where the clinician can withhold the information from the patient if it would cause them any harm or physical, emotional, or psychological harm. The next dimension along which consent is important is the law. Under most jurisdictions, obtaining the consent of a person before any medical treatment is a legal requirement. For example, in UK, giving someone a medical treatment before obtaining their consent constitutes as battery, whereas treating someone with incompletely obtained informed consent constitutes as negligence. Even though the, informed consent is a legal requirement, there are emergency exceptions that the jurisdictions also allow, where the person is not able to give their consent. But here also there are limitations. A clinician should never go through a treatment which they think that the patient, if they would have been in their competent mind, would reject to. The third dimension along which consent is important is the policy. Now, the right for obtaining consent has been recognized by most national and international organizations. Every organization says that a competent adult should have the right to make free decision about his or her own healthcare or treatment or medical intervention. Especially in the UK, the British Medical Council and the British Medical Association both have guidances for the consent, and most, if not all, medical associations have provided provisions for consent in their mementos. The last dimension, which tells us why consent is important, is the empirical studies. Most of the meta analysis and reviews have revealed that the process of obtaining consent is important for a successful client and physician relationship. It fosters a healthy development and a trust in the relationship. One review was by Stewart in 1995, which revealed that the process of obtaining consent allows the patient to increase their autonomy. It also led to symptom reductions, etc. Other empirical studies have been shown that, especially one review by Beer and Guthrin in 2001, showed that obtaining the consent led to greater autonomy of the patient as well as their responsibility. Most of the empirical studies have thus revealed that the process of obtaining consent is very important, as the patients mostly want the clinician to assume the role of a problem solver rather than a decision maker, and they would rather take their own decisions. Thus, I would like to conclude by saying that consent is not only important along the ethical basis, it is also important on the physical, legal, political, and psychological basis as well. Thank you.
Good evening, everyone. So, I'm Shratashwini Hazarika from Geography Honors Department, and today I would like to present on the unit consent by John R. Williams. Firstly, what is consent? According to Bushom and Faden, consent can be defined as an autonomous authorization of a medical intervention by individual patients. Basically, consent basically occurs when two or more individuals, voluntarily come to an agreement over a certain proposal. So, the concept of consent is important in all aspects of life, especially in the medical field. Consent is regarded as a fundamental of ethical principle of patient autonomy and respect for individuals. Patient autonomy basically refers to the patient's right over his own treatment that he will be receiving, and his own decision regarding his treatment and his diagnosis. And respect for individual means the medical staff fostering the patient's right over his treatment, and it refrains them from carrying out any unwanted interventions. Even though informed consent and consent in general is very important in the medical fields, but sometimes it is just not possible due to several reasons. One reason may be there might be language difference between the doctor and the patients. The doctor and the patient might have different dialects, and it might be difficult for the doctor as well as the patient to understand the diagnosis, the treatment, the names of the medicines, etc. Second barrier can be cultural differences. For example, certain ingredients in certain medicines or certain medical procedures might be considered as sin in certain communities or certain religion. Then the treatment becomes very difficult. Instance can be unawareness about the diagnosis. Sometimes the patient might not understand few medical terminologies, or the doctor might not be able to explain in a layman's term for the patient to understand. So such circumstances or such instances make it very difficult to obtain consent from the patient. However, there are two exceptions for the requirement of informed consent by competent patient. The first instance might be when the patient gives full authority to the medical staff over his treatment. The patient might have a do what you think is the best attitude. And in such cases, the medical staff should try their level best to try to make understand or give information to the patient about his diagnosis, about the treatment he will be receiving, about the possible outcomes of the treatment. But even though if the patient says that do what you think is the right, then the medical staff should respect his decision. The second might be that there certain disclosure of information might be psychologically or physically harmful for the patient. For example, a patient with chronic depression, if he comes to know that he is suffering from cancer, and if he knows that he might not survive it, it might lead to suicidal tendencies into him. So, under such circumstances, uh, the doctor might refrain from releasing certain information about the treatment or about the diagnosis. In such cases, the concept of therapeutic privilege is used. However, this privilege must be applied only under extreme circumstances. Also, in many countries, getting consent from the patient is a in the medical for a medical treatment is a legal requirement. For example, in the UK, under the common law, treating a patient without his or her knowledge is considered to be a form of assault, whereas treating a patient on the basis of half information or inadequate information is considered as negligence, and both of these instances have severe uh, lawful consequences. But what if there is a situation where the patient is unable to give his consent? Maybe he's in an accident and he's not able to sign a consent or say or give verbal consent. So under for such emergencies, the law works a little differently. In many jurisdictions or in many countries, the law recognizes the ability to perform emergency medical treatment on the patient if his life is in danger, or any delay in treatment might be life threatening to that patient. But such emergencies also have few conditions. The medical staff has to sign a directive or a living will as an evidence before carrying on with the treatment. Also, if the patient is having if he's psychologically ill and he's not able to give his consent, so in that under that circumstances, consent might be taken from his primary caretaker or his guardian. Also, in some jurisdictions, non consensual treatment is given under few circumstances as well. For example, involuntary admission of psychiatric patients with a communicable disease. So, I would like to conclude by saying that the concept of consent is very important in the medical field, and the patient, or even the guardian of the patient, or even the caretaker of the patient, should not feel the burden of agreeing to the doctor if they are not happy with the treatment or the with the treatment. And yeah, that's it. Thank you, ma'am.